Welcome again to Weekly with Westbury. The topic for today's podcast video is new modes in the delivery of healthcare. As we look at some of the advancement in technology in healthcare today in this little segment, there's always a few important questions to ask before investing in additional technology. Again, technology is nice, but how are we going to use it? How is it going to be implemented? So there's some questions to think about, and I'll give you a second to sort of read those and just talk about we're looking for what problem or safety or quality issue is it going to solve. Sometimes too, when we invest in technology, we do it a la carte, right? Just like you're ordering food at a restaurant, right? Do you want a vegetable? Do you want a potato? Do you want an extra salad? That's how it is with sometimes our EHRs and our technology. We don't use the technology to its full sort of way it was devised, right? And we can pick and choose what we want. And sometimes when we do that, we are not fully supplementing safety and quality and optimal outcomes. And that's a hard thing to really look at and digest, right? But we really need to further look into what the product's going to do and how it's going to help our organization and our stakeholders. And that's the healthcare team, of course, included with our patients. So my mission today is to show and discuss a few of the advancements that you're probably seeing now in clinical. And this is in no way a fully inclusive list, right? But it's some of the things that have come around that are probably either have been implemented or on the horizon of very soon in your organizations. One of them, and by the way, I use all different vendors and all different examples within this podcast. One is Epic Care Everywhere feature, and that's really a feature that's really helping coordinate care and really sort of assisting in that exchange of healthcare information and interoperability. And again, we'll discuss these elements a little bit more within our weekly modules. This is part of the EHR that really adds and sort of does a little bit of AI and encourages some of the documentation for interoperability. Secure Chat is another one. And we'll talk about many different devices we use or an all-in-one device. But in this particular example, it shows that your hospital or organization, I should say, smartphone, you can do some chatting through that. You can do it through the computer. And it becomes part of the legal medical record, okay? There are different elements, okay? This secure chat, by default, is not included in the legal medical record. So it can be sort of like if you do want to share some things that your patient's upset and reasons why, and emotional status and things like that, that is not going to be part of the chart, but more of a healthcare sort of handoff. But you can make it so it is part of that document. There's a lot of legal ramifications, and organizations deal with that in their security issues and with IT and the interprofessional team. But there can be secure chat that is, and then maybe you have some another form of messages that are not. So again, you're going to see different things happen in different organizations. Of huge discussion now is virtual sitters, violence safety monitors, and virtual nursing. You may hear just one term of virtual healthcare. This is having a team, whether the organization hires or the vendor of the sitting or technology hires workers. They can be sitters, they can be RNs, they can be advanced RNs, and their function is, yes, behind the camera in part. You can see that there's in the lower picture There is what the patient sees, and it is a virtual practitioner. And then you can see on the top picture what you, as the virtual nurse, virtual sitter, might be seeing. A lot of things behind this. It can be that the virtual RN is a virtual secondary nurse. Maybe they're doing the documentation and the primary bedside nurse is providing all the care, and they work in conjunction with each other. A sitter could be so that you're constantly watching, but maybe not sitting right in the room. This has been utilized in many places, and we'll talk further about that within our course. But also, it's showing to help with workplace violence, as there is an increase of that in the workplace. And bedside nurses make up the majority of the workers that are affected by this. Having said that, this conjunction and this teamwork has really changed opportunities in nursing, right? You may decide that you want to be a virtual nurse. You may work for a virtual company. And it has brought about kind of a consistency with the patient. Now, research has shown that sometimes we think like, hey, we're not sure about somebody watching us 24/7 on a camera. And there's times that we can turn it off, turn it back on. But actually, the research is showing so far that patients are actually, and families feel a little bit more content with this technology. Again, we'll see where that further goes. But I've included a lot of information, and we're going to, perhaps link some resources. I've given you some descriptions, too, about virtual nursing. Now, remember, I'm taking this in a couple different avenues. There's a virtual nurse, there's virtual sitters that might be techs, just volunteers, things that you see within hospital that have had some training but maybe not full nursing credentials, right? But the virtual nursing will concentrate a little bit more on. And again, if you think about it, this new mode of healthcare can really be successful, eliminate some of that documentation burden that we had talked about. It can really be a dual roles working together into high quality healthcare delivery, right? We can have a global healthcare equity through this expertise using informatics and technology. We can hit a bunch of different avenues of the community, services beyond, the acute care setting, etc. So think about this, and what have you seen, and what are you excited about if you haven't seen it? Again, I have included more facts too. The whole probably negativity you may have heard is, are we going to replace the bedside nurse? And that is not the element of what this service is supposed to be. It is to supplement. And you'll hear us say that again, it's to support and supplement, not to replace. And so think about that, think about how you feel. But it's the premise of virtual nursing is to bring the nurse back to the bedside. And it's to have someone else aid in that and have the patient have a little bit more kind of fulfillment of the demands in healthcare and the settings and etc. And so again, we're now seeing a lot of virtual nursing in triaging, in discharge teaching, making calls to family practitioners, and that's the virtual nurse. Organizations might not adopt all of the aspects of virtual nursing in one kind of swoop. They may start with triage. They may start with, discharge teaching, things like that. So again, there's a lot of things that can be done by a virtual nurse. HIPAA protection and violations of that seems to be at the forefront of virtual nursing as well. And again, the camera can be turned off, or we can excuse the if there's moments that are needed for privacy, patient privacy, privacy with the bedside nurse, etc. So again, there are things that are being done and watched for, HIPAA violations as well as in any other day. Sometimes we're finding out too that we, as I said, it may be a different avenue for interest in our own healthcare setting as a nurse. We may choose to have, those employees that might be on modified duty, they can function as a virtual nurse. So, I mean, there are some opportunities, we'll put it as that, right? And we also look at virtual nurses maybe being an asset to the growing number of new grads on shifts, and to have that dual kind of delivery mode, that could be beneficial. Think about these items, think about how you feel, and also look at what you're seeing, right? You might see virtual nurses a lot, or virtual sitters on mental health or behavioral health units. How do we feel about the complication there and privacy? Think about how you feel about these things. What if a patient's hearing impaired, has a hearing difficulty? This might not be the optimal patient for having a virtual, somebody on a, just like a visually impaired, somebody on a computer that is on a monitor, on a, however you want to say that somebody needs that face-to-face contact. So think about how you feel about some of these items. Many of you have seen Moxie, right? Moxie the robot. I sort of gave a lot of description here of who Moxie is. Moxie is one of the foremost utilized vendor right now. I'll include some other resources for this too, but what are we using robots for? And again, a lot of times, and they are artificially intelligent as well, so AI. They deliver a lot of things. They might deliver tray, medications, things like that. Their purpose is really to take some of the mundane tasks of the RN, and we know we have those, and fulfill those. So that's a new mode of care delivery as well. Patients are sort of excited when they see Moxie going around. Moxie talks. Moxie has eye expressions that are friendly, and patients really do look forward to seeing them. I've put more of the tasks on the screen here now too. And again, I think we're finding that sometimes Moxie's timing is a little off, and it depends on the demand increases, just like our time too, right? But the task, the goal for the task is usually less than 30 minutes. But we know that can increase. Dropping off specimens, going to the lab to drop things off, food service, pharmacy, etc. Those are really the tasks of Moxie. I will add too that Moxies, there are small versions of robots at home that are shown to prove helpful for some of our patient populations. One of them would be perhaps even children on the autistic spectrum. And those are helpful, and to make sure that there's some duties that are being carried out, etc., and they think of them as their friends and their sort of their assistants at home. So again, I just want to bring up again that you hear a lot of times that robots are going to take the job of the nurses or of the respiratory therapists or whatever. Again, that is not the format that we're taking in this course, nor I think in our profession. It is really to supplement and modify the care delivery. Of course, there's many other items too. We know we have a lot of items we wear on our wrists that can help, right? So smart data. Are we using this data in our organizations though? Because this can be very helpful. We can see sleep patterns. We can see perhaps a history of monitoring blood pressures. We can monitor EKGs. And again, there are some, we'll talk more about citizens' data, and that citizens' data really could be used to further implement a big picture of our patient. And we have these items now. People have these items. Are we utilizing them? What are we doing in the care settings, right? Well, a lot of times we can start even, we implement things on a smartphone to talk to wellness providers. They're triaging. And as you can see to the right, there's Wobot, who is a wellness care, more of a mental health, asking how you're feeling. Eventually that will lead to a care provider as needed, but it's someone to talk to. It's someone that is AI assisted. Yes, we'll talk more about safety and hallucinations, as we call, of AI that might not be perfected yet, but there is someone in the, behind, there is a person behind these items that is looking for authenticity. We're finding out that virtual reality, the headsets, etc., can really be helpful for finding ways to for many different patients, and we'll talk about that in a minute, but at home it can also help with maybe the opioid epidemic and offering alternatives to pain medication and taking us away and kind of giving us some comfort in some ways. We have a lot of all-in-one solutions now in smartphones and smart documentation items in our organizations. We may see at-home care technologies that information can come over to our organizations as well, as I said. You can see here that there's a otoscope that attaches to a smartphone to allow parents to look into the ears of children, perhaps, or any patient that maybe has frequent ear infections, etc. Now, yes, there needs to still be some education of these products and how to use them so we don't do injury, but there are things. Our consumers might be coming with a lot of information that they already have, and how do we receive that information and use that information and perhaps confirm what they're looking at home. We have robots that, as you can see to the left, that are, enabling people to stand from a wheelchair with these, robotic legs, so to say. So again, just to show you some of the things that we're seeing now in advancements. We've talked already about all-in-one technology. Again, we're looking at things that we have devices. Instead of having 10 different devices to do our job, we can have maybe an all-in-one. It barcodes, it allows us to document and place orders in there. It has photos, again, with safety protocols, of course, but maybe we're doing skin assessments and we're pressure injuries. We want to take some photos to put into our documentation, etc. So again, we're looking at ways to help and minimize the use of so many technologies when one might be able to do it all. We're finding out that we have a lot of things at home that can further or in between exams or visits or hospitalizations can do some work to diagnose, to aid in care, etc. And this is just one of them I just picked, and this one is a wearable ultrasound scanner. This one's for looking for breast cancer. And again, AI is picking up a lot more things that maybe, as it says here, AI can detect breast cancer 5 years before it develops. Again, it's new technologies and new modes of healthcare assistance. There's Opioid Halo, which is a at-home monitor and pulse oximetry device, for lack of a better word, for those that are going home on opioids, and there's so many, deaths and complications, maybe of respiratory depression, and not being diagnosed or found, maybe by our home personnel. And so there are things that can help to detect and alert a patient family member when there's respiratory depression and numbers that it links maybe to the computer, it links to something to alert, and it will automatically dispatch help. We're seeing a lot of robotics for our own patients' body parts, our body parts, etc. This is an example of a robotic ankle. I've mentioned a lot of technologies, and again, this is just at the cusp of many things that really will be there. We focus a lot on wearables, and we will talk more about that too, but remote patient monitoring. And the thought is that by 2030, not very far away, right, that's going to be a $3.4 billion market. So how do we manage that? How do we engage? How do we engage in it ourselves, engage our patients that have these items, and really get the sort of literacy of all of us out of this? And it can be very cost effective too if we're using some of this data. And we mentioned VR already, and it's being used for dementia patients too. We said those that have perhaps opioid addictions. We might use it on ICU patients. It's been effective where they can see something other than the four walls they're in, and it's been a very effective mode for mental health and for perhaps minimizing the need of pain medication, as stated before. This is just a picture showing what the vision of the future home-centered care is. You can see how much technology is within the home. Do we see a lot of this already? We actually really do, right? And again, you can see, yes, there's assistive robots there. There's a robot pet too. Again, we've seen these, but there's also the remote caregiver on the screen there. There's already a AI voice assistant, smart pill box, health monitors. You can see there's smart socks, smart shoes, all kinds of different sensors. We know we've seen smart scales for weighing, and implementing all of that data directly to a portal for the patient and to the EHR. Think about the care when all of this data actually goes to one place and can be utilized by so many different providers, organizations in healthcare, etc. Think about that for a moment. We've already talked about the quadruple aim and the quintuple aim, which is yet to come out, but probably will very soon. Remember, the aim is to reduce care costs, improve provider experience, enhancing how patients receive care, and advancing population health. I think that really comes very much into play when we talk about digital health touchpoints and the purpose to address the gaps in care access, quality, and again, the setting for this quality of care. I would be remiss if I didn't end this conversation with talking about human touch. As we bring in technology, we know as nurses we deal a lot with what about the human touch? And I think if you read the last comment, through champion nursing informatics, organizations can contribute to shaping a future where technology and human touch are living in harmony. They coexist to create collaborative care environments that deliver care where, when, and how it's needed, and how it will improve the overall well-being of individuals at a holistic level. Think about that quote. Think about how you feel about that. But we know we need that human touch. We can't be behind technology and never enlist the human touch. And we, as nurses, know that probably the best. And I want you to think about that as we're documenting. And maybe we haven't talked to our patient in the room for 5 minutes as we're typing away. How do we say, I'm going to put in a few notes and then let's sit down and let's talk a little bit. What is our approach, right? Because we still have to have that. No technology, no AI, no robot will take the place of that. And just remember, all of this is meant to really assist in care delivery, and help eliminate the mundane tasks of the RN. I hope you enjoyed thinking about some of these things, and I know you're going to see so much more. I'm excited to talk more about the advancements of technology.